Eating disorders are complicated illnesses. Probably among all the illnesses in psychiatry, they are the ones where the body and the brain are both manifesting these conditions in so many different ways. And these are illnesses that commonly co-occur with symptoms from other psychiatric conditions or maybe full syndrome illnesses. We often see mood disorder together with eating disorders. We frequently see anxiety disorders. Certainly in anorexia nervosa we may see anxiety disorders or obsessive compulsive symptoms or full disorder even before the eating disorder develops. And as we learn more, we're really trying to see what relationship those conditions have. But as we're managing these illnesses, this comorbidity and the complicated fabric of these conditions becomes important for the clinicians and the many different disciplines of clinicians who work together to take care of these patients. It becomes an important piece as we're trying to figure out the best approaches for these patients. The treatment for all of the eating disorders requires a sense of the behaviors that are disturbed and the behavioral change that we really need to see. For most of the eating disorders, we're aiming to help individuals do something very, very difficult, which is to normalize behaviors that have gotten way off track. And for some of our patients, to normalize their weight in addition. So we're asking in whatever setting they're going to receive the treatment, and for some it may be an outpatient behavioral approach, maybe something that needs cognitive behavioral therapy, or for our younger patients with anorexia nervosa, sometimes it's a family-based treatment that focuses on behavior. For some of our more severely affected, we're using day treatment programs or hospital-based programs, and at New York-Presbyterian Hospital we've got a range of services for these folks, and what we're working on is helping individuals better understand what behavioral disturbances they have, and helping patients, sometimes very ambivalent patients who may be reluctant to make these changes, helping them change their eating and their weight so they really can achieve full recovery. One of the things that we think about at our specialty program at New York-Presbyterian Hospital is that we never give up. Right. Recovery is always possible, and so folks may have participated in other treatment programs. Their readiness for change might be different, and our comprehensive services might make the kind of difference you know, that individuals need. It's very important in these treatment programs that we think about that partnership, a patient's readiness for the kind of change that's expected, and you know, the non-judgmental sense that we're there for when someone's ready to do this hard work.